very much for inviting me to AMWC. And we're going to be talking about exercise modalities that supply endogenous mesenchymal stem cells for the repair of the vital organs. This presentation is based on the research that was recently published by myself, the 2 articles published recently, and books that I have written that have been translated on 8 different languages. Now, let's think about obesity. Obesity is inflammation. It leads to inflammation, which leads to toxicity, which leads to hunger. The more toxic you are, the more hungry you are. And the more hungry you are, the more obese you're going to become. There are several causes of fatty liver. Of course, obesity is the number one, but there is a genetic inheritance component. There are side effects from medications, fats in the blood, diabetes. Fatty liver is associated with inflammation. Inflammation is aging. Inflammation is disease. And inflammation is associated with higher mortality rates. So liver disease is related to obesity, impaired glucose tolerance, insulin resistance versus exercise modalities that lead to a healthy and healthy living and longevity. Now, fatty liver has been repaired in the past with stem cell therapies, and mesenchymal stem cells are preferable to and more accessible to having a liver operation. However, these studies, the stem cell studies, include very small samples, and they often have opposite effects. So, for example, some of them show a decrease in albumin. Albumin is very important for the health of the liver. And they report improvement, but not complete healing. So mesenchymal, let's talk about what these cells are to understand that first. Mesenchymal stem cells are multipotent stem cells, and they are found in multitude in the adipose tissue. In 1 in 100 in adipose tissue are stem cells, whereas in 1 in 1,000 are in the bone marrow. So there's a lot more in the adipose tissue. They are immune regulators and they are pro-inflammatory inhibitors. So again, remember, inflammation is equal to disease and aging. Now, you can also get stem cells from burned skin. However, there is a lower mesenchymal differentiation capacity, and there's a lot of undifferentiated cells. So as we age, we have more cells, we have greater proliferation, but less differentiation. And this is how the tumors are created, because there's a lot of cells there, but they're not differentiated. They just sit there and they create tumors. So burnt skin derived mesenchymal stem cells are not as well differentiated as the adipose tissue or the bone marrow. So trauma-based technology may not be the best solution because they claim to have the stem cells, but these cells are not as good as the other ones. Now, exercise naturally increases stem cells and mesenchymal stem cells. The stem cells differentiate into mesenchymal stem cells and then into hepatocyte. I'm going to talk about this in a second. So we looked at 95 articles, 95 different studies with exercise and how that will repair the fatty liver. We looked at aerobic and resistance exercise, different protocols. And what we found is that in all of these studies, there was some liver repair, not 100%, but there was a significant liver repair. So what happens basically is during exercise, different modes of exercise, including effortless exercise that I'll talk about shortly, there is a natural release of the adipose tissue contents into the bloodstream. And as that is released into the bloodstream, because fat cells are really, adipocytes are basically storage units. They're like your closets that you put things in there. And you use them for energy. It's stored energy. That's what fat is. So energy production depends on the contents of the adipocytes, and it also provides an array of cells that facilitate important reparative processes like repair the liver or other vital organs. Now, the contents of adipocytes naturally released in the bloodstream after exercise can provide not only mesodermal and mesenchymal stem cells, but endothelial cells, smooth muscle cells, and hepatocytes that are very crucial for the repair and the good function of the liver. Here you see a histology report, and you see the sham means that there's no treatment, and the last one you see with the treatment after the 14th day after the treatment. As you can see, there is liver repair on histological reports. So the exercise-induced release of stem cells from adipose tissue also differentiate into hepatocytes. Hepatocytes have a very critical role in detoxification, metabolism, protein synthesis in the liver that is necessary for your liver to survive and do its functions. Adipose tissue cells have low levels of senescence. That's a very interesting thing because that means that there is something there that is related to anti-aging. Now, the hepatocyte cells derived from mesenchymal stem cells are involved in producing albumin. What is that? It's a protein that is made in the liver, and abnormal levels of albumin indicate liver disease, kidney problems, and inflammatory illness. So when you have low levels of albumin, it's not just the liver that you have to be concerned about, but also your kidneys. And also it may indicate a more general inflammatory disease. It also, the adipocytes also contain stromal cells that are like a binding, it's like collagen, but like in a different level. And this is basically a diagram that shows what stromal cells are and how they kind of appear. Now, there was a study of 8,862 individuals between 40 and 73 years old with non-alcoholic fatty liver. And what they found is there was creatinine levels were elevated, alanine aminotransferase, that's the ALT, the aspartate aminotransferase, at the AST, and the insulin resistance that is related with diabetes. So these are the variables that we looked at in our study: creatinine, ALT, AST. What is ALT, alanine aminotransferase? It's related with jaundice, but it's also related to diabetes and metabolic syndrome, cardiovascular disease, and cancer. So basically, if you have a problem with ALT, you're also a good candidate to have other illnesses like diabetes and metabolic syndrome and cardiovascular disease. So it's not just one problem, the problems increase. Out of one problem, they multiply. There was another study with 432 patients that reveals non-alcoholic fatty liver was associated with ALT, AST, triglycerides, and diabetes. So basically, there is a lot of different problems that can be created. Aspartate aminotransferase, the AST, is again related with hepatitis, with other liver disease, with heart problems. So it's not just the liver, the heart is involved, pancreatitis, and diabetes. There was also a study with 132,377 individuals. That's huge studies, basically. It's like very, very large studies. 64,875 men and 67,502 women. So around the same men and women, approximately at that size of sample. And they found correlations with ALT, AST, and ALP, and fatty liver. Now, what is the alkaline phosphatase? It has to be within a normal range because, again, it's associated with cirrhosis, tumors, hepatitis, drug intoxication, and anemia. It also is associated with tumors. So if your ALP is high, there may be a kind of a suspicion of a tumor that is around there. So but our methodology, we only had 10 subjects, so it's a small study. It has to be replicated. I have to say this from the beginning. The methodology included 10 pre-diabetic subjects with non-alcoholic fatty liver. The BMI was around 31.99, 5 females, 5 males, 54 to 64 years of age. And all of them had been pre-diagnosed with diabetes, hepatic steatosis, that's a very severe liver disease, and the diagnosis was on sonography reports and other variables. And what we did, we used ultrasonography reports, blood tests, and we looked at ALT, AST, ALP, albumin, creatinine, bilirubin, triglycerides, VLDL, which is the very low density lipoprotein, that's the large protein fat into the blood, CRP, which basically tests for inflammation, testosterone, cortisol, and we had other measurements that we looked at visceral fat, body mass index, basal metabolic rate, that's very important because that's calories burned at rest, and muscle mass. And what we found, these are the results for ALT, AST, and ALP, and albumin. They were all very significantly they were almost in the normal range, and 24.83% decrease in ALT, 30.40% decrease in AST, ALP 14.52%, and there was an increase in albumin. Now, the important thing is that all subjects had these changes across the board, but different subjects had different levels of changes. Some of them were much better off, some of them were not as good. And this is, again, the same results, but kind of larger for you to sort of see them more clearly, because when I talk very fast, it's sometimes the meaning is lost. Now, we looked at creatinine. Remember, we spoke about creatinine and bilirubin, and we looked at ultrasonography reports. Ultrasonography reports were very optimal for us, because we looked, most of them looked like people had a normal level in ultrasonography reports. We did not do biopsies, but just on the ultrasonography and these variables. And about 80% had almost normal liver, and about 20% had improved, but not completely normal. So they needed more treatment. And this is the average. So creatinine decrease about 19.67%, and the bilirubin decrease is minus 12.33%. Ultrasonography reports was 80% normal. Then we looked at triglycerides. TG stands for triglycerides. VLDL, it stands for very low density lipoprotein, and CRP is for C-reactive protein, which tests inflammation. And again, we found a significant decrease of triglycerides, VLDL and CRP, 24.13% in triglycerides, minus 23 in VLDL, and minus 33.33 in CRP. Also, we looked at cortisol. Now, cortisol is very interesting because that is going to stress you, and you're going to keep eating more. And as you eat more, the obesity, of course, will increase. So it's a very interesting variable. And we looked at testosterone because cortisol and testosterone are like a seesaw. When one goes up, the other one goes down. When one goes down, the other one goes up. So what we found is an optimal decrease of cortisol and an optimal increase of testosterone. Now, testosterone was within the normal range. So it's not like the women are going to start growing hair or anything, because it's within the normal range. It was very low. It was below normal range and became normal range after. And the muscle mass increased by 58%. So it was, you could see a very good result on the muscle mass. So again, this is the same results, only in larger, basically, slide. And BMI also decreased. BMR increased. We have seen BMR increases in other studies up to 91%, actually, but with normal subjects, not with a population that is not normal, that's pre-diabetic. This is pre-diabetics, so they're not as reactive. And this is all the results. All the results were significant. So basically, very important conclusion is that different forms of exercise, including the effortless exercise modality that we used, can release endogenous mesenchymal stem cells that can repair vital organs. Now, this research is very important because there is nothing else. I mean, the stem cells that you put from outside, there are different side effects. Of course, they work in many patients. However, in other patients, if the potassium channels are blocked, they can create tumors that is not going to be an optimal condition for somebody's body. So this research is important, developing novel treatments and to understand the importance of a healthy lifestyle, especially after the pandemic, that has really geared us towards the health factor. No more beauty. Health comes first, and then beauty. And then beauty can come from the health from within. So, and you can use that without basically recommended to your patients, but without having the adverse effects observed after stem cells that are some adverse effects or injections or invasive or trauma-invasive procedures. Now, this is some more research that I have been involved in. This is different articles that have been published. So there's several basically articles. You can find them on Google. Just type in my name, they're going to come up. And you can contact me anytime at science@IELLIOS.com if you need more information, if you have any questions that you thought about and you did not think just now, I'll be there to answer them for you. Thank you.